walk you through draining a Pleurex catheter. The first thing that you need is a Pleurex drainage kit. You can get this from SPD. You will also need, and I suggest taking in an extra set of sterile gloves with you. One comes in the kit, but just always take an extra just in case. I start with a clean workstation. Get your supplies ready. I open in the kit. Inside is a Pleurex procedure pack. And the actual Pleurex container that works by vacuum seal drainage. You open the pack. You will see the kit and the adhesive dressing. You set that to the side. When you open this, you would open it the same way you would any other sterile field, with the opening the flap away from you. Okay guys, you've prepared your sterile field. You still have on clean gloves. You want to go to your patient and remove the old cap. Discard of it. Remove your clean gloves. You normally would wash your hands, but I wouldn't suggest that because you don't want to leave your sterile field. You can have hand sanitizer close by to clean your hands, and then don your sterile gloves. Ready to apply gloves. The Pleurex container, the outside of it is sterile, the inside is not, so you don't want to allow the doctors to take samples or things like that. You could suggest that to them. You are able to remove the tape, remove the plastic sheet that's protecting the catheter tip, and drop it into your sterile field. You then get your supplies ready here. You have gauze. Set to the side, you have 3 alcohol swabs. You have an emergency clamp in case there's a problem while you're draining and you need to close the system. And you have a sponge to go back on the skin. You also have a new sterile cap. You would then come over to your patient. You have one hand, it will get dirty. You'll pick up the catheter tip. Take the first alcohol swab and the tip. Do not go inside. That could break the seal and allow air to backflow into the tube. Second swab, clean again. You would then attach the Pleurex drainage system to the catheter. Your roller clamp should come closed, but always ensure that it's closed before you get started. You remove the silicone piece and engage the container by plunging down, pushing down. Once you've done that, you will slowly unroll the roller clamp to begin drainage. It's normal for patients to feel some discomfort when doing this procedure. If they do, you can use your roller clamp to slow down the drainage or to even stop it for 5 minutes for them to feel better. This procedure can take 5 to 10 minutes. sometimes 15 minutes. If you're here for a while and you notice that, you become contaminated, that's why we suggest having a second set of sterile gloves, just in case. While you're waiting for this to drain, you're talking to the patients about how they're feeling, you're assessing their respiratory rate, shortness of breath, pain or discomfort, anything that they might be experiencing. Okay, great. Once you're done, you remove the catheter. You have disconnected the catheter, and now you're putting on your sterile cap. With your last alcohol swab, you want to clean the skin around the site while assessing it. You're looking for drainage, warmth, just the general condition of the skin. You have a pad here. Be careful not to tug the catheter. We'll put this on. Coil the catheter in a circle. Cover the pad with a 4x4. Use your transparent dressing. Remove the paper side. Center. It's hard to do with gloves on, you guys. Don't worry. Just like with any of the transparent dressing, work your way around the edges.